All right, how are you doing tonight?
I'm good. How are you?
I'm tired. It's late.
It is late.
It was a busy day.
Very busy.
It's a busy day. It's really tough when you work from home and your Wi-Fi goes down for a few hours in the morning and the reliable internet service that you pay an arm and a leg for isn't as reliable.
Yeah, I wonder if the Starlink goes out like that.
We should get Starlink.
We should.
We've never talked about that.
No, I just hear about it.
Well, I think we should maybe get it at this point. Why not? Spectrum's not cutting their weight. So I'm thinking maybe Starlink might be good.
Yeah, I mean, it only goes out every now and again, but when it does, we really rely on technology and the internet.
Yeah. Well, again, I mean, yeah, of course we do because we work from home. So any kind of hiccup during business hours is not great. Not great at all. So, yeah. So we have kind of bounced around some ideas for today's topic, for this podcast topic. And we had some stuff, and then you said to me earlier today on our walk, why don't we talk about last year's episode, which we've never talked about publicly before,
True.
Which was my heart condition that I had from the time I was a child until last year when I got fixed. Fixed, not as in a vasectomy, but as in my heart was fixed through cauterization. Basically like a surgery of sorts. Yeah.
Yeah, a procedure.
I'm waiting for you in the wings to talk or ask questions.
Well,
we can bounce back and forth. I don't want to monologue. I want to dialogue with you.
Yeah, well, it's not something you actually really like to talk about.
I don't. In fact, I hate talking about it.
You do. So
I do.
We haven't even we talk about everything, and we like to look back on past events and talk about them and see the Lord's faithfulness in things. But this is something that really since last year we've not talked much about. So the details are going to be a little hazy for me. Mainly because, just the thought of everything you went through is uncomfortable to you. But when you were a child, you first noticed what you used to call like this weird heart thing that would sometimes happen. How did it present when you were a kid?
It would present itself very rarely. So I would be playing a sport or running, and not even every time that I would be playing a sport, but just on occasion. My heart rate would go from a normal heart rate or even a running heart rate into all of a sudden it would spike, and it would go into such rapid heart rate that I would have to get on my knees, lay on the ground, and then after some odd minutes, seconds sometimes, it would immediately kind of jolt back into a normal rhythm, and I could feel it. And,
no wind down, just
no wind down.
Bump, 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 bump to regular rhythm.
Yes.
How often would that happen?
When I was really young, 11, 12 years old, it would probably occur once every 9 months, a year, something like that. It was infrequent enough that it wasn't such a cause for, I thought, alarm. And I was pretty active, so it wouldn't do it anytime I was active. It would just do it sort of randomly on occasion. It was very odd.
And at one point when you were a child, your parents did look into it. Yeah. Is that a heart monitor? Or?
Yeah. I went and saw a cardiologist, and they put a heart monitor on me, which the heart monitor in that moment could only record the beats of what was going on in that moment. It couldn't actually really detect if there was something faulty going on truly with the heart.
Yeah, everything looked normal, good. You didn't have any episodes while the monitor was on. Okay, so when we first met, you would still have it happen, and I would say we met in our 20s. It happened more than once a year. Still not all that often. On occasion.
Yeah.
And you'd have me feel it. You'd be like, come here, feel this. Yeah. Because it really would go from, it was interesting to feel. It would go from so fast to just instantly back at a normal rhythm.
Yeah.
Did it scare you then?
It scared me 100% of the time that it happened. From the time I was a kid to up to last year. Yeah. It was scary. I remember one time I was working out with your dad. We were lifting, and we were really into it. You know, your dad was a bodybuilder at one time and stuff. So I was young. This was a long time ago. I was trying to impress him. You know, doing whatever weight I could do, whatever. And all of a sudden the rhythm, I'm pushing the weight up, and then I could feel it. It went from a normal heart rate to boom, 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 boom. And I was like, oh, I'm like, hold on a minute, hold on. He's like, what's wrong? I'm like, well, you want to feel something? And he's like, yeah, whatever. And so I said, give me your hand. And I put it on my heart. And he's like, are you okay? Do we need to call the hospital? I'm like, is this something that's happened to me my entire life? I haven't passed out. There's no pain involved. It's just me, I guess. It's something to do with my heart. And I've even had it checked out before, and there's nothing else to it. And it will go back down into a regular rhythm in just a second. So hold on a minute. Let me get on my knees and do my little position thing.
Yeah.
And then it would. And so, yeah,
And
but
yeah,
it was
no
always
symptoms.
no other symptoms. And again, it wasn't a painful thing, but it was always very scary. It was always very scary.
Okay, so then something changed a little over a year ago.
Mm-hmm.
Say a year and 3 or 4 months
Yeah,
ago.
yeah. It started exhibiting itself outside of just doing things that would cause my heart rate to go up. So it wasn't just when I was doing things physically per se. If I was in the shower, if I was sitting down at the table, sometimes if I was just sitting on the couch, all of a sudden my heart would go from a normal rate to rapid rate, and then it just kept happening so much more. The frequency was occurring such a higher volume that it became extremely freaky, to the point where it left me for several weeks sort of inoperable. I mean, I stopped going to the gym. I didn't want to. You would go on a walk, and I wouldn't even want to physically go outside and go on a walk. I would really just, and then when it got to the point where it was happening so much out of nowhere, there was a few days where I remember I laid in bed, and I just stayed in bed.
Yeah,
I wouldn't
because
even go anywhere.
Not only was it happening with new prompts, and I mean, inactive prompts, it would last a lot longer.
Yeah.
Some of the normal things you would do you'd lay down on your stomach, or you'd get down on your knees, those things were not making it go back to a normal rhythm. Like, it was taking a lot longer.
Yeah.
So yeah, you started to be really freaked out about what was happening, not getting out of bed. And then that led us to think, okay, this is something, even though you've had it always, it is doing some new things. We need to look into this, coupled with the fact that it was starting to make you not able to go about normal life. So I remember we prayed, we talked to my sister who's a nurse, and she recommended a doctor for you to see, who works with Mercy. And so we went to see him, and actually you had an episode when we got to the doctor's office, like still in our vehicle.
Yeah.
And your heart was not going back down into regular rhythm.
No.
Almost where we didn't know if we'd get to go in.
I had to remember I got out in the parking lot and pretty much got on my knees and tried to finagle myself in that position again that could get my heart rate back into that normal rhythm. And it wouldn't for a long time. I threw myself in, I guess, the van we were in the van. And I was moving stuff out of the way. I was like, I'm going to die. Because I was like, this is the craziest thing.
Was there pain
ever.
then?
No, there's never pain. It was always the same thing of just like rapid heart rate. To the point where you can't function. Like
Makes you anxious.
More than anxious. Again, you can't, listen, I know you've never had this before. Not everybody does, thankfully.
Yeah.
When you're in this position, it stops you in what you're doing. You have to stop. You literally have to lay down. Mm-hmm. It's like if you were in a sense, if you were a superhero, which, I guess I'm not, you're flying and you're going like so fast. You're going supersonic speed. But your whole body is stationary. But your heart rate is the thing that's going, is recognizing the supersonic speed.
Yeah, it's like your heart is reacting like you just ran your guts out.
You ran a marathon, but you didn't do anything.
Yeah.
That's how weird it is.
And
That's how
sitting
odd it is.
down
Yeah.
doesn't help.
No.
So we go into the doctor. He hooks you up to a machine. There's an EKG, right? He did an EKG.
They tried to do an EKG. They couldn't even read it because during the EKG, my heart started exhibiting those types of rhythms again. And he's like, I can't even get a reading on this.
Yes, your heart was going too fast.
Yeah.
Yeah, so he had us do some blood work. And initially he was like, you're fine. It's okay. Not a big deal. But then when we went to get your blood drawn after, he called back and said, hey, you know what? If you have another episode, I would say just go ahead and go to the emergency room at Mercy. You can tell him I sent you and just have it checked out. I feel more comfortable about that, which is kind of even scarier because at first it was comforting that he said, okay, you're fine. Go about your business.
Yeah.
When he said just go to the emergency room, was that settling for you or...
Is that a trick question? One in which you just you know the answer to this?
I do know the answer to this.
No,
yes.
I thought I was gonna die.
Yeah.
I thought that. Oh my gosh! He just told me I'm gonna have to go to the emergency room over this. And no, I mean that's just so. No, I was not doing well. I kept telling you, I'm like, I think this could be it. I mean, this really might. This might be the end.
Yeah, there was a lot
Really
of
was
prayer for sure.
I know we're talking about this right now, but I probably won't want to talk about it again. I mean, it was really in that moment of that time period, the scariest thing by far that I've ever had to go through so far in life. That it really was a sense of out of control, an out of control feeling.
Mm-hmm.
It was horrible.
Yeah. So with that word from the doctor, we came home. You did not have another episode. And also when you have a lot of kids, it's hard to plan. To just make a random trip to the emergency room whenever it might be happening. That's not easy to do. So we decided to get some help and just go to the emergency room.
Mm-hmm.
Even though you weren't having an episode.
Mm-hmm.
Right? Is that
right?
Okay.
Right.
So while we were there, you went through all this stuff, and I was wanting it to happen there. I know you were not. You were being very careful to not get worked up, to move very slowly. I think just mentally it had really kind of shaken you because there had been so many days of having them and it being upsetting.
Yeah.
Okay.
I was shook up.
I know.
Elvis Presley. Shook up, lady.
So I wanted it to happen there because the only way that they could tell or give us any indication what was really happening, of course, I had Googled it and I had kind of narrowed down what I thought it was, but obviously I'm not a doctor with Google, but...
We're not doctors.
I had a thing that I thought it was based on just reading.
Right.
Obviously that couldn't make me treat it, but it didn't happen there. So they had you hooked up to a monitor, but they couldn't tell anything.
Right.
So they sent us home with a device that would, what was that called? It was like a heart monitor.
Yeah.
And it would be on all day. You had to wear it for a few days and stuff. Okay, so the night we got home from the hospital, was that when you had one?
That night or the next night, yeah.
Okay.
Yeah.
And it was really long. Was that the really long one?
Yeah, it was a really long one. Yes, yeah. It was 45 minutes of 200 plus beats a minute. Crazy.
Which your resting heart rate is normally what?
70 beats, I think, per minute, something like that.
Yeah, 200 is really, really fast.
Yeah.
Really fast.
Yeah.
Concerning.
Like NASCAR fast.
Yeah. So, the very next morning, I called whoever I could call. I think the heart specialist. There was a heart specialist that you were going to get in to see eventually. They kind of hooked us up with. I went ahead and called his office and asked him if they could see what had happened the night before because they were monitoring the data from that heart monitor. And could they tell me what that was and all that? So I talked to a really sweet nurse who was able to confirm that they did see it, that, it was really fast. And then we got in sooner because of that.
It expedited everything.
We had to wait, it was a Friday, I think, when it happened. We had an appointment Monday. And actually, the original guy you were going to see didn't have an appointment, but another doctor did sooner. So we're like, we'll take him.
So this was an electrocardiologist.
Yes, an electrocardiologist.
Yes.
I feel like there was more names to it.
Nope.
Nope. Okay. So he specialized in the electricity of the heart.
Yes.
There's nothing wrong. Yes. There was nothing wrong with your heart or the muscle, but there was a faulty wire sending a signal. It was misfiring.
Yes.
So an electrical issue. Actually, what they told us that you had was supraventricular tachycardia.
SVT.
SVT.
SVT. Yeah.
Yeah. So we get in to see the doctor, and were you nervous to see him?
No, not at all.
I know.
I like how you're just smiling. Like, yes, I was nervous. I was so nervous. We haven't talked about this. Like,
That's true.
Publicly. I didn't want to talk about it with even family, loving, wonderful family. You know,
yeah.
It's the most uncomfortable thing to physically go through that I've had to go through. I mean, you've gone through 6 babies, so whatever. But you know, this is really, really uncomfortable.
Yeah.
But we got to go see Dr. Awad at Mercy Hospital, and we asked a lot of questions.
We did, and was that what you expected?
What, a doctor? Yes.
No, his attitude towards it.
No, because of course I want to start with like the worst question imaginable that you can ask is like, am I going to die? And of course the answer is, of course, someday. Like, duh, we're all going to die. But no, I wanted to like pare down the scariest questions first and then get down to, okay, well then what do I need to do and stuff. So starting with, is this imminent like death sentence or what is this? Am I never going to be able to get off the couch again? I mean, that was, for a little while, that was kind of the thinking in my mind. Like, if this doesn't get fixed, what kind of father can I be? If I don't even, I would go to the gym 4 or 5 days a week. That's what I do now. That's what I was doing then before the crazy episodes. But if that had lingered and lasted,
it was paralyzing.
It was paralyzing. It was a paralyzing sense of fear, but a physicality to it that, the physical nature of the heart and everything, it was just like, it was impossible to do anything.
Like, you would have been more comfortable had it been like your arm having an issue or something, like, especially it being the heart.
You can take an arm, you can take a toe. Yeah. The heart is essential. So, went to see the doctor. And he explained what I had. And he explained, I had SVT, and I said, well, how serious is it? And he goes, well, out of all the heart issues that you could possibly have, he said, if I had any heart issues, out of all the various issues you can have with a heart, he said, yours is the one I would want. It's not fatal, so yay. He said, it's more annoying than anything. Is that the word he used? Annoying.
Mm-hmm. It's just annoying.
He said, it's just annoying. And I'm like, dude, annoying is getting your socks wet in the kitchen. I've been in bed for the last 3 weeks, paralyzed, like not able to physically get up. Yeah. It's more than annoying. But he kind of talked it down.
Yeah.
Which is fine.
And he also said because it's fixable.
It's fixable, right.
You can fix it, treat it completely. Other things, you might have to be on medication for your life and all that. This was like, and he said there was a medication you could take. It wouldn't fix it, but it could help, or you could have a cardiac ablation, which would take care of it.
Yeah.
Fix it. Reorder
the wires of the heart. It would cauterize the wire that was going awry in the heart to stop doing that kind of misfiring, essentially.
Yeah, and he said that if you didn't have it, you could live with it.
Yeah.
Which you really couldn't.
You can't live
the
with
state that you
no,
were in.
No.
But he said that with people that, he's seen over time, it begins to happen more and more frequently, and it does get harder and harder for it to go away. Oh, because that was the other thing I asked the nurse. If you were to have another episode over the weekend before we got to see the doctor, what should I do? Should I call 911? Because that night that it happened for a long time, I wanted to. But I also knew I would freak you out more if I was like, I think we need to call 911. The best thing for you was to remain calm. So that's what I was trying to do, is just to remain calm. But then it was like, yeah, am I making the right decision? All those things. So I asked her, should I, if it happens again? And she said that I could, and she told me the drug that they could give you a shot of something that would instantly make your heart go back into a normal rhythm. And so what the doctor told us was there were other moves you could do that you didn't discover on your own, that sort of bearing down that could make it possibly go away. For some people, a cold shower or putting their head like in ice water would shock your system back into rhythm, which is not always convenient to carry around. Like,
I don't want to carry around a bucket of water everywhere I
go. Or yes, you can go to the hospital, explain what it is, and they can give you this shot of, I can't remember what it's called. Fruit fly. So.
Fruit fly. Fruit fly. Okay.
He asked, do you want to schedule a cardiac ablation?
Yes, which we did. I said yes, of course.
Absolutely.
Yeah.
So I think you had to wait like 3 weeks.
It was about 3 weeks of time. Yeah.
And I think they did put you on a medicine, a heart.
Yeah. I was on a medicine for a while. For a few weeks before that, and then before the cardiac ablation, I was on a medicine that would keep my system just totally at a more
down. But that made you tired, level. And you certainly didn't want to do that.
No, golly, no.
So, you want to talk about the procedure?
Yeah, so we... I don't like to talk about this. I really don't. This is the one and only time I'm talking about this. Okay. No, I mean, so we drove to the procedure, and there really is like a sense of, because when you know they're going to put you under, and, you know, they start in the groin, and they work their way up.
Send like a super tiny
wire
camera and a wire. They don't have to cut you open.
I don't know about camera.
Well, they have to see.
Well, yeah, but I think they see with some kind of
through your skin.
Yeah, okay. yeah. I don't think it's actually like a little iPhone up your groin.
I think there's a camera, but
yeah, okay. Well, there is a camera, but it's a little different. And for me, they knocked me out. I don't even have.
Oh yeah, they're not. Well, they try to have you just very, very sedated, which you also were like not sure about this.
Yeah.
They like to have you very sedated because they have to make it happen. Yeah. They have to trigger the SVT so that they can see the spot that's causing the problem and ablate that spot. But the whole thing about, you were like, will I know what's going on? Will I be aware? That was like making you uptight before you even went in. You were the most uptight I've ever seen. Like, because we've had so many children, I have thought like, it would be nice if you could just do the next one, because, you know, like take your turn. But then like seeing you in that state facing something, I'm like, yeah, it's better that I'm the one that goes through this and not you.
Yeah. Yeah. No, totally. Yeah. I was a complete mess. I was a complete mess of also just thinking like, gosh, I'm 30, I think it was 37 at the time. I'm not ready to go just yet. I want a few more years. You're still very pretty. I like to be with you. It's fun to kiss you. It's fun to be with our kids and all of that, you know?
Yeah.
Are we having a moment? You're putting your hand on me? Or are you, okay. All right. Are you telling me to like, hey, settle down.
No, it's sweet.
Okay. Well, yeah. Yeah, it's very peculiar, the thoughts that, so obviously this was it wasn't my deathbed or anything, but really when you start thinking in life, this could be it. You know, they're putting you under, which for anybody who's going under for anything, even if it is just for an arm or a leg, there's always risk involved. And there's always a sense of, oh, today's not like I just got out of bed and I had a normal routine of a day. I'm going through a procedure. And for me, that sense of, you know, something could go wrong. Something could happen. It really did give me a sense of looking at, I want to, if I make it past this, I really want to value life more. I really want to see life. I think I'll see life from a different lens almost, because you realize how short time is, even if that had been the end, or if I get 30 more years or 40, 50 years left, there is a sense of, oh, this really does come to an end. This life really does, at some point, have its consummation of ourselves here in this time period. And, highly emotional. Yeah.
Yeah. So, you get, what?
This is a year removed, so it's not like this just happened last week
It
or
happened
whatever.
last March, so
But,
it is exactly like...
Yeah, it's about a year ago. Yeah.
Yeah. So you get into the operating room.
Yes.
You would not let us call it an operation or a surgery. You were very adamant. We had to call it a procedure and only a procedure because it freaked you out if we called it anything other than a procedure. It was a procedure.
You can call it whatever you want now.
Okay. And yeah, they had to put you all the way under.
They did.
Yeah.
The anesthesiologist guy was scary. He looked like a pirate, and he seemed to take a fancy to you when he was in the room at first, and I'm thinking like, because he even gave you his card. He's like, here's my card, and he put his personal phone number on his silly card.
Yeah.
And he gave it to you, and he was like, if you ever have any anesthesiologist personal needs, you can let me know. And of course, I'm not even really in my right mind in that moment, but I'm thinking...
He also insulted you.
Yeah, he said what I had was a woman disease, or not a disease, but he goes like, it's not that big of a deal what we're doing. And it's pretty much as women get this, so you'll be fine. He was kind of chauvinistic about it, actually.
Yeah, you didn't have any fun with that at the time.
I didn't have any fun with that at the time, but he, that
made you even more...
It made me more uptight because I'm thinking, like, this guy's hitting on my wife, and he's about to drug me. And he's giving her his personal number. So what if he purposely gives me too much drugs? And that's the way I go. I don't know, just crazy thoughts. Crazy thoughts. Anyway.
Crazy thoughts.
Yeah.
So, I think it was like 2 hours or something, and your parents came with me, and they sat with me in the room where we waited, and that was really cool to have them there. And then, he came in, and the doctor came by for, like, briefly. I mean, he does how many of them a day? The doctor was very, very cool. He was very laid back, like, good at what he does, and I think he does 3 or 4.
3 or 4 at least a day.
5 days a week.
5 days a week. He's an expert. He's amazing. He was a really, really great electrocardiologist.
Yeah. So he came in and he said, we found it. We got it. Done.
Yes.
I said, like, you're sure you got it? And he said, yes. He found it and he got it. And he said, too, to me that he could tell. He's like, yeah, no wonder he was so uptight, because I could tell if he did anything, if he coughed, he sneezed, it was going to set this thing off. Like, that's how sensitive it was. And I don't know why it had gotten to that point where it was so sensitive, but he could tell that because he kind of he razzed on you a little too, that you were a little uptight about the whole thing. But he was like, I got to give it to him. Like, he could tell why that would put you on edge the way that it had.
Yeah.
But yeah, he found it and he got it.
He found it and he got it. But they're also, so the thing with that is, now, I haven't had any sign of SVT since then, so praise God for that. But for a few months after the procedure, there was still what he called like bumps and things with the heart. So my heart was still not precisely normal. So I could actually still feel like abnormal flip-flops of the heart multiple times a day, 50 to sometimes 100 times a day. And I would tell you, on any given day, I'm like, hey, I had like 60 or 70 a day. You think I'm still good? Like, am I, is there something abnormal to this? But thankfully, probably 3 or 4 months went by, and slowly but surely, things have evened out, and it's very rare that I feel anything abnormal. On occasion, but nothing has leaped back into the SVT crazy heartbeat rhythm that I once had.
And there's like a really, really minor chance that within the first 5 years after an ablation, it could come back.
Okay, let's not talk about it anymore. Let's not talk about it anymore. I'm done. I'm done. That's it. Okay, but can you quote the poem? The poem that gave really just a lot of peace. And after the procedure, there was just that sense of, that really spoke a lot of truth to us, which was the one that you found by Anonymous.
The "O ye of little faith."
Yeah. "O ye of little faith."
I'm getting screwed up if I do it.
No, you can do it. You can do it. I'll help you. Ready? O ye of little faith, God hath not failed thee yet. When all is dark and gloomy,
thou
dost so soon forget. Forget that he has led thee, and gently cleared thy way. On clouds he's poured his sunshine, and turned thy night to day.
And if he's helped thee hitherto, he will not fail thee now. How it must wound his loving heart to see thy anxious brow. Oh, doubt not any longer, to him commit thy way, whom in the past thou trusted, and is just the same today.
That was cool.
Yeah, he was very faithful, and we're very thankful.
We're very thankful. Yeah.
And it's pretty cool a year later that you're good, you're healed, and we've had a whole other human.
That's right. I'm good. I'm done talking about it.